Hello everyone and welcome back to GEMNIC Science. In this tutorial, we're going to be looking at some basic problem that has to do with coagulation. Let's imagine you're a doctor and a patient arrive with an anticoagulation issue. So what will you do? I would like to take you step by step through the management of anticoagulation problem in a very simple, easy way to understand. I will also explain why each step is very important. So let's dive in. Let's assume you're given this kind of problem which says the patient is 55-year-old on warfarin therapy. He presents with excessive bruising and nosebleed, and their INR is critically high at 6.0. So how can we solve this problem? Notice that the INR is simply an abbreviation for International Normalized Ratio, which is usually around 2 to 3 for most cases. But in this case, if you multiply 3 by 2, which is simply going to be 6. Meaning that this 6 is critically high, and that is not what we want. Another important thing which you need to take note of is the warfarin therapy. So, what is warfarin therapy? Remember, on our previous video on the anticoagulation drugs, which we talk about the warfarin, which we said is a class of drugs, or is a drug that falls under the class of drugs known as the VCAS. VCAS. Notice that the VCAS simply stands for the vitamin K antagonist. When we said antagonist, it's simply a molecule that binds and stops a reaction. If it doesn't stop a reaction, it will slow down the reaction. And here we have the warfarin, which is a class of drugs that target this vitamin K. What is vitamin K and why do the warfarin target this particular guy, vitamin K? Notice that vitamin K play a crucial role in the production of certain clotting factors that are essential for blood clot coagulation. The clotting factors which are being produced by vitamin K are the factor 2, 7, 9 and factor 10. So I'm going to drop these two links down below in the description section, which I'm sure is going to be very important for you to understand first before you dive into this problem. First is the coagulation cascade, which involves both extrinsic pathway and the intrinsic pathway. And second thing is the anticoagulation drugs. The VCAS, other example of VCAS drugs, which is the vitamin K antagonist, we have the warfarin, which is common, and we have the acinocomarol. And other drugs we have phenydione, etc., etc. Notice that we must first try to assess which type of bleeding we have. Is it life-threatening bleeding or non-life-threatening bleeding? Example of life-threatening bleeding, we have the brain or internal bleeding, and the non-life-threatening, we have things like the bruises, which we have in this clinical problem, or nose bleeding. After this important investigation, the second step which you need to take is the laboratory investigation. Here are some key tests which you really need to perform. First is the INR test and CBC test, then the RFT test, which is the renal function test. The reason for the International Normalized Ratio test is simply just to confirm the level of the anticoagulation. And the CBC test is just to check the hemoglobin to see if the patient is losing too much blood. And the last but not the least, which is the RFT renal function test, the word renal has to do with the kidney, is simply to determine if the kidney are contributing to this problem. Notice that if you really want to have an effective treatment as a doctor, you really need to perform these tests because they help to pinpoint the cause of the severity of the issue, guiding the treating so that it can guide you for the right treatment decision. After performing this test and you find out that this problem has to do with the warfarin which that old man is taking. So first thing which you need to do is to stop the warfarin. After stopping the warfarin, you need to administer vitamin K. Because if you could remember, we said the warfarin is targeting vitamin K and it serves as antagonist. Antagonist is simply block the process of the vitamin K production or slow down. And the next thing which you need to do is to monitor the international normalized ratio. When administering the vitamin K, first of all, you need to check the patient condition. So is it mild or severe? If it is mild, you can simply just administer oral drugs around 2.5 milligram to 5 milligram. But in severe cases, which is dangerous cases, you have to use the IV vitamin K for faster reversal. And it's also important to monitor the INR every 6 to 12 hours just in order to observe if it is improving. Why is everything which we mentioned here so important? First, let's start with stopping the warfarin. I will repeat again. We said warfarin falls under the class of drugs known as the VCAS, which is the vitamin K antagonist. So, warfarin is an antagonist to vitamin K. So, stopping warfarin prevents further anticoagulation. What if, as you are trying your best as a doctor to tackle this problem, but the bleeding becomes life-threatening? What will you do? So, at this point, you need to take what we call the PCC or FFP. Notice that the PPC simply stands for the prothrombin complex concentrate. Complex concentrate. So what about the FFP? This is simply the fresh frozen plasma. Notice that this first one, which is the prothrombin complex concentrate, it simply reverses coagulation or quickly reverses coagulation. What about the FFP, which is the fresh frozen plasma? We use this if this first one is not available, meaning that we use the fresh frozen plasma if we don't have the prothrombin complex concentrate. But the good part of it is that both the prothrombin complex concentrate and the fresh frozen plasma, they have almost the same mechanism of action. What they do, they simply replace the clotting factors and stop bleeding fast. But notice that surgery may also be necessary if there is a severe damage. Another important step which you should always take as a good doctor is reassessing and educating your patient. Imagine to say your INR previously is 6, but with what you do as a doctor, you manage to bring it down to 3. So next thing you need to do is to adjust the warfarin dose and also educate your patient. Then you have to schedule for follow-up. Notice that this is very, very important because prevention is always better than cure. So this is how we handle anticoagulation issues step by step. But always remember, every decision is based on patient conditions, and monitoring is the key. Thank you for watching. See you next time. If you find this video helpful, please just do me a favor by clicking on the subscribe button. Also like and share. See you next time. Hello everyone and welcome back to GEMNIC Science. In this